And then Harry, are you bringing out some really affordable tools for all of us so we can do this?
So, I'll start, and the answer is yes, and a couple of other things.
Was that yes, you should pay for it?
In some instances, yes. In some instances, yes. In some instances, we should be paying people differently for the way in which they're practicing based on their use of those tools, sharing with them some of the savings that get created when things are done better and more efficiently. But it's also got to be, the technology also has to be important. One of the things that's vital between the patient and physician is that we have to be finding ways in which, as Martin will tell you, you've got to be part of the workflow for the physician. We also got to be finding ourselves to be a better part of the patient's lifestyle. And we have to be fully integrated into what they're doing and not a distraction to them.
Martin?
Sure. So I think the general question is, when you really look across the country and ask about adoption of technology, the numbers are pretty low. So typical hospital using electronic medical record, that number is in the 15% to 18% range. For privately practicing physicians or physicians in small groups, it's under 10% at this point. So why hasn't it happened, and what will make it happen? So the real challenge is that you're in the healthcare system, when you start to think about the physician, you're taking the most highly educated person in the workforce. And in the traditional model, you're asking that person to be a data entry clerk, to actually enter data. And as you can well imagine, that doesn't go very well. If you go meet with your investment portfolio manager or someone who's managing a big mutual fund, I will tell you the person who's managing that portfolio is not taking the orders. And the challenge that we have is that we need this digital age to allow the orders to be taken by devices that can deliver accurate, timely information and then convert the most knowledgeable person into a knowledge worker. And when you do that, you will find that they see that tool as part of the practice of medicine rather than something that's ancillary to the practice of medicine. And I expect the adoption curve will go up exponentially.
And those tools that Martin's talking about, Harry?
Well, I think an important theme that's come through here is really the transformation of healthcare. I mean, all of us are interested in technology, and we're in a technology meeting here. But the more important thing is, how can technology enable the transformation of healthcare? How can we really fundamentally change how medicine is delivered, how healthcare is delivered, how patients and consumers are more engaged in their own care? Technology is one piece of that. And I think one of the factors I mentioned earlier is that as we have seen other industries transform, the financial services industry, the travel industry. I mean, how many of you actually went to a travel agent and got a physical ticket to come here, right? Yet, if you needed a prescription under the old system, right, you'd have to go to a physician and have them write out something. You'd carry it somewhere else. So how do we start changing these workflows? How do we change these processes and use technology to make that better and safer? I think the other thing we now have available is, I often talk to physicians and I say, like, Martin, are you a good doctor? Like, how would you know? How would any of us as physicians know that we actually practice high quality medicine unless we have good data about how we practice and an ability to compare it with others? And so if you look at the span of healthcare that the four of us here actually cover, the hundreds of thousands of physicians that we interact with and the millions and millions of patients that we interact with globally, how can we take that data and help both patients and providers make better decisions about healthcare?
From our perspective, one of the things that would be helpful, so I talked about patient safety earlier on and just getting e-prescribing in. A lot of these tools, actually, many of the companies who make them provide them for free to physicians' offices. They're still not being adopted. Health systems and insurers have a responsibility for the physicians who they're working with in helping them make the right decisions in using e-prescribing tools. If it's that valuable and decrease cost, how do we make it a quality metric, for example, in how we measure it? Definitely something that would help Americans today. Earlier on in our keynote speech, one of the things we heard about a little bit is how a different generation, was going to use the word younger, I decided to go with different generation, is utilizing digital health, different communication tools. And today, when we talk about tools and we talk about health information, we're all really like, well, it's our private information, we shouldn't be sharing it. Whereas if you went on Facebook today for medical students or college students, everything's out there. They share information about who they've seen, what are they taking, finding out, do you have the same issues? Can you recommend a really good doctor? That's happening today. But for those who are writing the policies, they're not looking, I think, at how that trend is shaping HIPAA information. So one of the questions I have is, as that generation begins to interact, and I'm going to start with you, Martin, because you sit on some of these commissions, how is that being looked at by regulators in shaping the types of regulations that may come from the FDA going forward, that they share information already?
So it's an interesting question, and I'm not sure who's going to lead the way. I actually think that consumers can lead the way, and in fact that there are two models that are going forward. One, there's national policy that's coming from Washington that's really focused on privacy and security at this point in time. But it is looking to write blanket rules for a nation of 300 million people, spread across 3,000 miles. I think those are going to be challenging with state rules that can usurp those if they're set more stringently. On the other hand, when you look in the private sector, in the Google space, in the Microsoft space, I'm starting to see consumers really lead that way. And they've run very far ahead. As soon as you allow the individual to control the flow of the information, you get rapid and accurate exchange of that information to whoever needs it. So I'm not convinced that the policies will lead from Washington, but they may well, in fact, follow what's happening, being driven by the consumer.
And Harry, based on what you're doing.
Yeah, I think one of the issues is, when you think about privacy in healthcare, you have to think of it in a slightly different way. Obviously, privacy is key for the willingness of individuals to have the information shared in different arenas. But I think more importantly, we often think of privacy as, in the same way we think in the financial world, as sort of identity theft, people grabbing your whole record and being concerned about that. Most consumers, who's got information about themselves they want to hide? There we go. Thank you very much for your honesty. For most of us, there is a piece of our healthcare information that we don't want to share. It's some of you going to the local Walgreens to get a medication for a rash you picked up while you were here in Vegas. Okay? That's information. There we go. That information you may not want broadly shared, but other information about you think is very important. And so one of the challenges to all of us is, how do we provide consumers with granular control over their health information, their private information, that will, number one, give them confidence that that information will be used properly, but more importantly, be of value to them when they show up at another facility for care.
Dick, are you guys seeing that different? Because you have different products for different segments of the population.
Some very interesting things about this, where we operate with three principles. First, it's got to be secure. People have to have confidence that unwanted access isn't there. The second, we got to build trust, and we don't have that trust yet. And third, we have to be able to provide continuity in an otherwise fragmented environment. Let me give you a case in point. If you have a malignancy, you are likely to have 4 different docs taking care of you. Your primary care doc, an oncologist, likely a surgeon, and maybe a radiation therapist or a plastic surgeon, whatever. In this day and age, the physician holds on to the record. Our records are stored by the physician. Unless they're in a group like Cleveland Clinic, you have multiple records. That's what makes Cleveland Clinic one of the safest places in America to practice medicine. You get one record. But if you're out there in the general population, like most people are, your surgeon may be planning an operation when your internist may have started you on a blood thinner because you're at high risk when you have a malignancy of getting a clot. You really need to know that that's getting on. You deserve to know. That's why our principle